Okay, so now we're going to DC an IV. So you will have a doctor's order to DC. Unless the patient has an infiltrated IV, then you can DC that on your own, and you need to call them to see if they want it restarted or not. So make sure you've checked your order. You're going to go in the room and wash your hands. You also need to put gloves on to remove an IV site because you might get bodily fluids on you. So wash your hands, put on your gloves. Explain the procedure to the patient. If they have IV fluids running at that time, you need to go ahead and stop that. If it's on a pump, turn your pump off. If it's flowing to gravity, just clamp everything off before you remove anything. Okay? You want to have some gauze and some tape, or gauze and a Band-Aid for your dressing. So you want to gently remove the tape, especially if it's an elderly patient. You don't want to give them a skin tear. And you want to peel your Tegaderm down away from the site. You don't want to pull up like this, because then you're going to pull this cannula up and that's painful to the patient. So you want to pull from the top and work your way down. And you want to be securing this site, because you don't want to pull the cannula out of their arm at this point. So make sure you're holding on to it really well, stabilizing it. Then you're going to take your gauze. You're going to place that over the site as you pull the cannula out. And remember, I told you to inspect the cannula, make sure the tip is intact. You need to document that the tip is intact. That's very important because it doesn't need to be dislodged in the body. Okay. Some nurses will put just this piece in biohazard, and the rest of this system can go in the garbage. So you put that in biohazard. Your IV tubing and everything will go in the garbage. And then you're going to dress your site, applying pressure. And you're going to put your tape over your gauze. Or you can use a Band-Aid, either one. You just want to make sure that this isn't bleeding at the site, especially if someone is on blood thinner. Sometimes they'll bleed a lot. So before you leave the room, make sure that the site has controlled bleeding.